Welcome back to the KUSI Weekend Morning News. Did you know that teenagers account for 4% of all plastic surgeries in the U.S.? That's nearly 350,000 procedures. With what you should know before your teen goes under the knife, Dr. Scott Bartlebort, Chief of Plastic Surgery at Scripps Memorial Hospital in La Jolla, joins us. Thank you for coming in this morning. I did not realize so many teens were getting plastic surgery. Why is this?
I think it mimics the trend that we see overall in society. The amount of plastic surgery being done now in adults and children or teenagers is more than it was 10 years ago. I do think that there's more awareness also of some of the options available because of some of the greater publicity that's
They've had TV shows out, all these makeover shows, and so teens are actually looking at these transformations and saying early on, I need to look different than I do.
Well, it's a combination. If this is done properly, it's a communication between the teenager and the parent, and sitting down in a very informed way, making decisions. And the approach that I take on this is that this type of surgery in teenagers, and we're most often talking about 17 or 18-year-olds here, not 13 or 14-year-olds, but that these are people who have some type of there should be a clear and justifiable reason why they're having it done. This is typically to correct some type of deformity or deficit. This should not be some little subtle correction that they're in.
So you recommend enhancement type surgeries and things like that to improve looks, or if it's not a necessity when you're a teen, don't do it. Is that what you're saying?
I think so. I mean, I think that it's a time, plastic surgery is a serious decision for anyone. Okay, but during the teenage years, it's a time of dramatic change, both physically, mentally, emotionally. And you want all that to have stabilized pretty much, and so you know what the endpoints are going to be, because a typical nose does not reach maturity until about 16 years of age. I don't think that you really want to be operating on a nose on a 12 or 13-year-old when you don't know yet what that nose is going to look like. And the same is true.
And that's the #1 surgery for teens.
Yes, it is.
Their nose.
Yes, it is. Followed by ears being #2, and then of course breast reductions and things such as that.
And sometimes though, breast reductions or some of the ear work and some of the facial work, this is necessary. You're talking about, we've seen children who've had extreme deformity. I mean, that's when you really want to consider plastic surgery for your child. Is that what you're saying?
Correct. If they just have a small little bump on their nose, I don't think that that's enough of an issue to warrant putting them through a surgical procedure. If, on the other hand, they have a very large or out of proportion nose, or it's deformed and breathing issues with it and so forth and so on, I think then you sit down in a very rational way, go through the pros and cons of it, and make sure they understand this is surgery. Most of them have not had surgery at this point. This is not getting your teeth whitened. This is not getting your hair tinted. This is a surgical procedure.
There are risks.
And just as it can go well, you can also have complications, and you know, you don't want them to have to deal with those. If you
we want to give some people some information. Dr. Scott Bartlebort, Chief of Plastic Surgery at Scripps Memorial Hospital, La Jolla. If you'd like to get some more information, there is a number on your screen right below us here at home, and they can actually call and get a consultation and find out if indeed they're in a situation where they need plastic surgery from you.
That's correct.
Thank you so much for coming in today. Very informative.